Welcome back, everybody. Many women have suffered a miscarriage but have gone on to have healthy babies. But some women aren't so lucky. That's where our next guest can help. Welcome back, reproductive endocrinologist Dr. Stephan Krotz and Dr. Michael Allon from Advanced Fertility Center of Texas. Also joining us is one of their patients, Rene Arrowood, who is pregnant. Hi there. Let's just start off with the fact that I think a lot of women, until we get pregnant, we don't really realize so many things about pregnancy. And one of them is that miscarriages are common to some degree.
Miscarriages are very common. In fact, out of 100 pregnancies, really only 40% of those will actually go on to have a baby at the end of 9 months. And a lot of times when you have a missed cycle, even 3 or 4 days, it may be actually that you are pregnant, but you just didn't know it, and then the pregnancy did not take, and so...
yeah, and nature has a reason for that. But at what point do we say, okay, wait, something's wrong here. This is not just nature taking its course, something's wrong.
Well, we used to do our investigation after 3 miscarriages, but now we're really recommending it to do it after 2 miscarriages. And some people even think doing it after 1 miscarriage. There's certain tests that we can do through the blood test and with the ultrasound that are very simple to do, and we can find the root of the problem, and we can solve it fairly quickly without having the emotional problems of having another problem come on.
Rene, you are pregnant now. You had almost given up and said, okay, I'm not having another child.
We did give up.
Yeah, but what was your situation? Because you do have children.
Yes, I have 2 of them, and the first one went very fine. Then I had 2 miscarriages and was very unprepared for that. But then I had a second daughter, and that went fine. And then I had another miscarriage, and I thought, what is going on? And so I went to my OB because I could tell that some hormones were kind of out of whack. And so she confirmed that and sent me to Dr. Allon, and that's when we started treatment. And
here you are.
And here I am, yeah. I mean, you know, I had to change some things about my diet, and we tried several times, and I had another miscarriage while under his care, and you know, we just gave up after a while. We tried for almost a year, and it just wasn't working. So really, I just started praying about it, to be quite honest, because my loss wasn't that I couldn't have one biologically. I'd already had 2.
Right.
My loss was we'd had 2 daughters, and my husband really wanted a son, and so I felt for him. And so anyway, we gave up, and then it kept nagging at me.
Yeah.
So on a Monday, I went in to see him, and I said, what do you think? I mean, you know, it's not working, but it's bugging me. And he said, well, you know, we have a decreased ovarian reserve, given my age. And he said, that's what we're up against. And so I went home and talked to my husband again, and he said, you know, I just don't feel compelled to try the medications again. I feel like we did a mock IVF, we did the IUI, we did, you know, everything that we could do, and it just didn't work. And then on that Thursday morning, I noticed, it's like, I'm 3 days late. And I thought, oh, great, now I'm not even cycling. What is wrong with me now?
Yeah,
and so,
it's because you were pregnant.
Well, and I thought, you know, before I call a doctor and start telling him, oh, da-da-da, you know, I thought I'll take a pregnancy test and rule that out. And it was positive.
Yeah.
And I just stood there shaking.
So she said a couple of things there. One is confirmed that my hormones are out of whack, because sometimes women don't understand that after even childbirth that they can go out of whack, and that can impact whether you can have successful pregnancies after.
Right, and so that's one of the first evaluations we do. We do a lot of the basic evaluations for infertility, and then we check some other hormones too, to see if they are involved in miscarriage. Yeah.
What other things can be involved in that? You look for what, different abnormalities?
We look for certain things in the blood. Sometimes the body can produce antibodies to attack its own pregnancy. Sometimes the body can produce a blood clot and not allow enough blood flow to go to the pregnancy. And so in those occasions, when we determine those factors, and we use like blood thinners, and sometimes in addition to a baby aspirin, of course, once we find hormonal problems, we fix it right away. And a lot of times when we do an ultrasound, we put a little bit of water inside the uterus to make sure there's no fibroids or certain other things that may interfere with the growth of the pregnancy.
Yeah. So in other words, checking out everything so that you can intervene and cut off at source whatever the problem might be. Do you suggest when women say, okay, you know what, I think I want to have a baby, that they go in and get at least the blood work done and everything done just so they know what they might be up against, as opposed to, I know, you know, people who try for years and years and years and finally go in and then age is against them. So should you, from the get-go, say, let's just do the basic physical?
Well, there are certain kind of basic rules. We generally advise women, if they've been trying for a year and they haven't gotten pregnant before the age of 35, to go in. or if they're over the age of 35, and then if they've been trying for 6 months, then we advise them to go in. If they've had 2 miscarriages, then they should go in for an evaluation, because a lot of times it will be a simple fix, and then they can get pregnant after that.
Yeah, because I'm always amazed at how little we women know about having babies. So until we have one, like I didn't know that there's only 1 day a month really that you can get pregnant. Only 1 day out of the month. Why are there so many people in the world? Okay, Rene, do you know what you're having yet?
I'm having a boy.
Oh, congratulations! Thank you, gentlemen. Advanced Fertility Center of Texas is offering a free consult to anyone who calls and mentions Great Day. For more information, call 713-467-4488, 713-467-4488, or log on to infertilityanswers.com. Coming up, we'll give you